Thank you. I'm Dr. Philip Robinson. I'm the Medical Director of Infection Prevention at Hoag. Many patients have been asking me when they should see their doctor or go to the emergency room, and that's really based on the symptoms that you are experiencing. If you believe you have been exposed to the virus, even if you are not showing symptoms or have very mild symptoms, you should stay home and contact your healthcare provider. If you just have a runny nose, maybe a low-grade fever and some fatigue, you'll probably be fine just to stay home and take care of yourself and let the virus run its course. You can certainly call your healthcare professional and ask for advice, but there are certain symptoms where I would recommend that you make that call and possibly be seen by your healthcare provider. These would include increasing shortness of breath, a fever over 100.4 degrees Fahrenheit, headache, and certainly the inability to eat or drink. You can contact your healthcare provider or one of Hoag's urgent care locations, and you will be provided with instructions over the phone. I'd like to briefly address the issue of testing. We've all heard a lot about testing, and testing is changing, and those who get tested is also changed. We have moved from trying to contain COVID-19 to a mitigation strategy. This means that we are trying to minimize the consequences to our most vulnerable community members. As a result, only those who are most at risk for the serious complications of COVID-19 should be tested. This means that if you are without symptoms or just have mild symptoms such as that sore throat, a little bit of a cough, or a low-grade fever, you do not need to be tested. For this group of people, the test results will not change the recommendation to stay home and self-isolate. However, if you have symptoms, and those symptoms are progressive, and you become sick enough to be admitted to the hospital, a resident of a nursing home or other group home, or a healthcare worker caring for the elderly, you should be tested. I also want to stress the fact that data from Irvine and other cities is reflective of where the virus cases currently are. In other words, transmission didn't necessarily occur in Irvine or in that particular city. It could have occurred elsewhere because COVID-19 is currently present in all communities in Orange County. In fact, the actual counts from city to city could be, and most likely are, higher because testing is currently prioritized to those who are at greatest risk or who are the sickest. Asymptomatic individuals with mild disease may not be reflected in those counts, since many of them would not have been tested. And this just reinforces the importance of practicing social distancing. As directed by the governor and Orange County healthcare officer, regardless of the case count in your particular city. Social distancing truly helps reduce the spread of this virus. Besides keeping you and your loved ones safe, it eases the burden on our hospitals and healthcare systems, and it protects the most vulnerable residents in our county. When it comes to Hoag's preparedness for COVID-19, let me start by saying that we have been ready for this for months. In fact, we've really been ready for it for many years. Like many hospitals, we care for patients with infectious diseases frequently and are well prepared to provide them with the best appropriate care while ensuring the safety of our staff, patients, and visitors. We have a world-class infection prevention team leading our efforts, which include education, training, drills, so that our clinicians have the information, tools, and communication systems to properly screen and isolate patients for infectious conditions. Hoag has specialized wards at both campuses where we are cohorting patients who have or may have COVID-19 so that we can better protect our healthcare workers who are caring for them. Hoag is very grateful to serve a community that is so generous in rallying around the hospital. From free meals to supply donations, The community has lent a helping hand to support the hardworking men and women at Hoag as they tirelessly try to care for these patients in need. On behalf of the entire organization, we thank you.